I think Mindy wants to know that. Mindy has a question about headaches. She said, I've had migraines for over 30 years, used to treat them with Excedrin and Advil. 2 years ago, I was diagnosed with chronic migraine. I'm on, this one, venlafaxine. Mm-hmm. Did I say that right?
Effexor.
Okay. ER and sumatriptan.
Imitrex.
Okay, as needed. I just started using Adjuvie monthly, self-injector shots 8 months ago. I still have 4 to 5 migraines a month, down from 25.
Jeez.
I also take vitamin C, magnesium, zinc, vitamin D, multivitamin. I don't know what that word is either. Stradivari and rhodiola daily. What else can I take or do to manage better and maybe have a none month? That is a lot.
That's a tough one. I mean, to me, it looks like she's doing pretty much everything. A couple just first thoughts. I don't expect it to make all the difference in the world, but make sure she's taking riboflavin. Riboflavin and magnesium are kind of the gold standard from a supplement standpoint. Potential there could be some help from that, but she is taking a multivitamin even. So she is doing the Ajovy, so she's even on the cutting edge of the medical prevention at this point. Yeah. I think I would mention sometimes even drugs in the same class or newer versions like Nurtec. You have to hop around on drugs. Honestly, I think if one's not working, that's why sometimes the drugs seem a little bit like Me Too, and they're just drug company money grabs. But other times people just swear one worked for me. Yeah. Maybe Aimovig will work for her, and Ajovy didn't, or Emgality. There's a few she can try that are all expensive, but she's at this point on the Ajovy, so it's shouldn't be a financial difference,
right?
Especially if she can show the insurance that she has tried it and essentially failed it.
Yeah.
And Nurtec is a new one as well that she can take and is a pill. So that may be nice to try something that's not only different, but that also could take as a pill versus an injection.
Yeah.
That's really good.
I can't imagine 4 to 5 migraines a month. I have one a month.
Yeah, she's doing everything. She's doing too much to have that little benefit. That's a shame. Yeah, I would just look to switch some things up.
Yeah.
For sure.
Is there a dietary element? She didn't say anything about that, but for folks that are dealing with migraines, I think I've heard people say inflammatory stuff in the past, like dairy and grains. Is that a good place to start?
Yeah, I mean, I think with a lot of that, you're just maybe kind of playing around with triggers.
Yeah.
I mean, there are things that can jump out at you, certain meats, alcohols, and such things that would be easier to eliminate, but that certainly would require some drastic changes, drastic monitoring, and journaling and such. But yeah,
and working with somebody.
That's a massively foundational part.
So like an elimination diet to try and find what some of those triggers are.
Yes.
Okay. Well, but that's not. I'm sure she's done that. If you're having them 25 a month, that is not a place I want to hang out.
And then even for Mindy not to shortchange what she's kind of going through. I mean, we're fortunate enough to have a nurse practitioner, Joyce, on staff who will look at this through a different lens than us three can.
Yeah. That's a really good point.
And she can kind of, hopefully, ideally, look at things from scratch and, just kind of go with the whole holistic approach. It's worth a conversation.
Always trying to get more brains working on the problem there.
Right. And that's used to working with individualized patients and, harder to solve issues, so to say. I mean,
yeah.
So obviously Mindy unfortunately falls into that.